There's a lot of changes that take place in a woman's body when she becomes pregnant. It affects almost every system of our bodies. Sometimes the stress of the physical illness, such as nausea, breast tenderness, fatigue, can take a toll on the woman, in addition to any interpersonal relationship changes, financial strain, concern about the future. All of these converge on a woman that's pregnant and can lead to some depression and anxiety. As the pregnancy progresses, sometimes these symptoms worsen, and that's when we have to be aware of the potential anxiety that may have arisen. Good afternoon. Hi, it's good to see you. Some of the main signs and symptoms of a postpartum mental condition can include increased irritability, appetite disturbances, difficulty with bonding with the baby. About 70 to 80% of women will experience some of these changes, but after the first 2 weeks after delivery, we expect there to be an improvement. And so when these symptoms persist past that time, then we start thinking about postpartum depression and not just postpartum blues. Postpartum depression is caused by a number of different factors. There are a lot of hormonal changes that take place during pregnancy, as well as afterwards there are a number of shifts. There's also the stress and demand of a new baby. There's sleep disturbance, which leads to fatigue. There can also be chemical changes within the brain that take place as a result of all these things. And so when all of these converge on a woman, then that can lead to postpartum depression. A woman who is pregnant or a new mother has a lot of different options for treatment for depression. During and after pregnancy, starting from counseling services, medication, involvement with a psychiatrist, any combination of these, depending on what the patient's needs are all available to the woman. It'll be decided by her symptoms and her needs at that time. There are a number of medications that are available, typically in a certain category, that are safe in pregnancy if needed, and can also be used during that postpartum period while breastfeeding. The advice that I would give to expectant mothers or new mothers is to never be afraid to seek help. If you feel that something is not right, don't feel guilty if you're not just overjoyed, happy about your new baby. Our ultimate goal is for you to be healthy, to be an awesome mother, and to have a healthy baby.